Hello, everyone. Welcome to our House Bill 2420 work group meeting. Start with just a couple of notes. Today, we're going to be looking at a few of the options that we didn't have clear votes on from last time. We're also going to be looking at and voting on the draft recommendations, which you've all had a copy of, hopefully had time to review. So the thing to remember, some things to remember, this is a public meeting, it's being recorded. And work group members are invited to speak and to post in the chat if you would like. The ground rules: let the facilitator facilitate, share the air, participate and engage, use the parking lot, ask questions, listen to understand, use the raise hand function to speak, use the chat to share links, not for ongoing commentary. Only work group members can speak or post in the chat, and the meeting is being recorded, and we'll send out notes within 2 weeks. Glad to have you all here. Let's do a round of introductions. We'll start at the top of the alphabet, which means that we're starting with Lucy, then Ginger, then Janet.
Hi, everyone. Lucy Gibson, Federal Revenue Specialist for Oregon Department of Human Services. Good to see you all.
Thanks, Lucy. Ginger, then Janet, then Joy.
Good afternoon, Ginger Sorolla, Lead Deputy Registrar for Jackson County.
Hi, everyone. I'm Janet Fredrickson. I work for Josephine County Vital Records.
I'm Joy Goodwin. I work for Douglas County Clerk's Office, and I am the.
Thank you. Then we have Derek and Sarah and Paula.
I'm Derek Patterson. I'm the liaison to the county for the State Vital Records Office.
Hi, Sarah, Office Manager, Macy and Son Funeral Home in McMinnville.
I'm Paola Souza, Clackamas County Registrar.
And then we have Wally and Jennifer.
Wally Ordeman, Oregon Funeral Directors Association.
Thank you. And did I miss anyone who's a work group member?
And I'm Jennifer Woodward. I'm the State Registrar, Manager of the Center for Health Statistics in the Oregon Health Authority.
Thank you, Jennifer. Anybody who hasn't introduced themselves yet who's a work group member? Okay. Thank you all for being here. We're going to ask Cindy to share the remaining issues. We have slides again to go through. We'll be going through and there are a couple of them that need discussion, and then we will be voting on the options. Cindy, are you able to share? Right. Okay, so this is an issue to address. I wanted to give folks some time to think and talk about this. So last time we voted on recommending some options, and one of the things that came up in terms of the things that were voted on is the work group voted for different access for birth records, a 5-year access for birth records in the county where the event occurred, and for death records for 1 year of access. So just wanted to check, is the work group recommending that death access remain the same and birth access be extended to 5 years only for events that occur in their own county? What do you want to do, if anything, about the disparity? What are your thoughts? Just wanted to hear from the work group members. What do you think about this issue? You can go ahead and raise your hand or come off mute if you're a work group member. Paula.
For me, I would say 5 years each.
Lucy.
I also say 5 years for both.
Alright.
I agree.
Okay, who was that? Who said I agree?
That was
Ginger?
Joy.
That was Joy. Ginger, I see your hand. Thank you, Joy.
5 years for birth certificates, 1 year for death records in the same county.
Janet?
I say 5 and 5. It's just going to confuse people.
Okay. Wally?
I also think 5 and 5.
Okay. Janet, is your hand up again, or is it still up from before? Okay. Any other comments? Derek?
I'm curious about sort of why people voted for only 1 year for the death and 5 years for the birth. I think my concern is that there are issues for both of them, and that maybe we haven't sort of explored all those issues completely. We haven't really discussed these options. I personally am against changing the issuance timelines for both, because there's a lot of I think there's a huge impact on the system that we haven't totally been able to discuss. So that's my opinion.
Thanks, Derek. Ginger?
In regards to the death records for 1 year, reason I'm thinking that route is due to the amount of research that can and may need to be done with death records. Beyond that, the proof of eligibility seemed a little bit easier in terms of birth records. That's just my opinion.
Thanks, Ginger. Other thoughts about the issues or Jennifer?
Yeah, I'm going to follow with Derek. I think that, first of all, having it being consistent, I agree. Having it be consistent is great. I think, again, the concern is, this is still that it's with the births within their own county. So it's not really following the spirit of equitable access across the state. And then, of course, I'm going to, it is a significant, particularly for the births, a significant cost for the state because of the shift of work, which we really don't know for sure. So, I'm a little bit more supportive of it if we have some other options related to helping cover that loss of revenue that we would have at the state. So I know so if we do it, it would be nice to be consistent. I would stick with 1 year and stick with what we currently have until we have a better idea of how we can fund the system.
Other thoughts or comments about this? Derek?
Just to follow up on Ginger's comment, I think that's sort of what I'm getting to, is that there are some issues around birth issuance that we haven't been able to discuss that are more complicated. The logistics of certain things like certified no record letters, or more complicated eligibility that also exists with birth that would have an impact on the state and the counties. So I think that's kind of my concern, is that there are some of those issues as well.
Right. So there are issues around consistency, not confusing people with different numbers of years. There's issues around equitable access across the system and across the state. There's issues in terms of cost and where the money is going and where the money isn't going if we shift these things. And then there's an issue around complexity of researching or understanding eligibility to receive the records. Other comments about this this topic? Janet.
I have to agree. When I was reading through the draft and looking at, seeing some figures there that are just, I would imagine, guesstimates really. And then you do have to think about workload for my staff, because it's basically one person. So it is a lot more complicated than, just saying 5 years or 1 year even. It's just, I agree. There is a lot more that I think needs to be looked at.
So Janet, what would you like to see in terms of a recommendation for now? What are your thoughts?
After seeing the figures, I would say, I was thinking 1 year, 2 years was kind of where I was at with it. But I think it does need to be, delved into a little bit deeper.
So you and I have some more information or some more insight before you want to make a recommendation to change what's happening now. Am I understanding that?
Yes,
Yeah. Okay. Thanks, Jen.
definitely.
Wally?
So I think this question is for Derek and for Dr. Woodward. Am I to understand then that if we vote for a change, if there were to be a change from the current timeframes, that the technology overhaul, the logistics and the complexities of it are still in question? Not knowing where funding's coming from, not knowing what the technology is gonna, what's gonna happen with the technology. Is that accurate?
Yeah, I'll take this one. Yeah, so the combination of because just to the counties make their money off of death certificates. The state makes their money off of birth certificates, and so having the analysis that's in the report shows the birth certificates shift at 5 years, with the idea that you could go to any county to get the birth certificates for 5 years, but that is one of the prime, that's a large group of what we also, our customers as well. So it's not only and again, it's an estimate of how much shift would go to the counties versus the state, but that cost doesn't even include the system changes that would need to have happen to make it occur. So that loss is just the loss of revenue, does not include the system changes. But there would be, because the system is coded now for birth and death for the 6 months. But again, there would be system changes if we changed any of these related to the time frame.
Does that answer your question, Wally?
It does. I find myself awkwardly voting on things like this just because of the unanswered questions. I mean, you just answered them great. I'm just saying that there are unanswered questions if we go forward with recommendations that change the timeframes. And I almost look at this particular question, and there will be others, I'm sure, that I'm voting more for a wish list than what's actually as opposed to what can actually be utilized and done. And so that's an awkward position for me as a funeral director and representing a boatload of them.
Alana, can I provide a little bit more context here just to
Yes,
help?
please.
So I
Please.
think that one of the things this is a legislative report that we're submitting to the legislature to say this work group came up with these options and ideas for meeting the bill. Now, what the legislature does with that report is up to them. So this is not saying there will be legislation to do this. It's we're saying that these are our thoughts. These are the options that we came up with following the request from House Bill 2420 to come up with options which we think would be equitable. And of course, they would want to probably see what the estimated costs would be to do those things, but there's nothing that says that this is what they would be requiring to put in law. That's their decision on what the action steps they take for the legislative report.
That I understand that, and thank you for the explanation. I go back to my term wish list, and it seems like if what you just said is the case, then it seems like we provide what we think ourselves and those that we represent would want, and then the legislature can decide what's doable and whether they think we're wrong.
Sure, and that there are consequences. No, there's no such thing as a simple change. If you change one thing, it also means these other 16 things.
Sure, sure, and,
yeah.
and you always have to watch for unintended consequences, and I absolutely get that.
Okay. So so we need to vote on this, and now in this conversation we've identified a bunch of additional issues, right? One is the changing of where revenue goes. One is the issues around equitable access. Another issue is the issue around the complexity and the impact on the staff, as Janet was mentioning. So I want to try and see where people are at this point, having had this conversation. Do you still want to make the recommendation that came up from the last conversation? So does the work group now, and I'm just responding to things that I've heard today, does the work group now want to recommend that access to birth records be 1 year for births that occurred in the county, for the county to supply? Can I see what where people's hands are for that? So the recommendation would be 1 year for the county to provide access for birth records when the event occurred in that county. Can I see people's hands for that? Yes, you can do a physical hand. I see Wally's hand. I see Janet's hand. I see Paula. I see Sarah with the electronic hands. I'm trying to make sure. I see Jennifer.
I have a question though. When we did the survey, there were more options than 1 and 5, right? I think there was 1, 2, and 5, or 1, 3, and 5.
Yep. I just wanted to see Virginia's hand. So yes, I'm just asking based on the conversation we just had, Paula. That's why I'm asking the question this way. So and I don't know. I see Joy's hand. So these hands now at this point are voting for access to birth records for 1 year in the county that the event occurred. So, and I said all of those names. Cindy, did you get all the names? And how many were there?
I have 7, but I don't know if they were all said. Do you want me to list the names that I have?
Yeah, will you just say the names and make sure?
Sure.
And I want to make sure that that we've recorded people's votes correctly.
Okay, so I have Wally, Janet, Paula, Sarah, Jennifer, Virginia, and Joy.
Okay. And okay. So Paula,
Sorry. Yeah, I'm sorry. I'm just kind of on the fence because I think if we change it to 1 year, there still will be the cost associated with the system changing for 1 year or 5 or 3 or whatever. It will help. It will ease the revenue for the state instead of 5. It's just 1 year. It will help families to, because I think during the first year is when they request the most. So yeah, I guess one. Yeah, just keep my name. Sorry, I'm just kind of having all these
Yeah.
scenarios in my head.
Thank
All
you,
right.
Paula.
Okay.
All right, so that's a majority. So now I want to check for the access to death records. So that was, so the question now is, does the work group want to recommend that access for death records where the event occurred in the county is for 1 year at the county? Can I see where people's hands are for that one? I see Janet, I see Sarah, I see Paula, I see Joy. Who am I missing? Wally, thank you for waving. I see Lucy, I see Jennifer. I see Virginia. Did I miss anybody who voted for that one? Okay. So that one also passes. Lucy, I see your hand. Is that with a question or is it still up?
No, I was going to say I missed putting my hand up for the birth records. Go
Oh,
ahead and
okay.
put me down for that, Cindy, please.
Thank you, Lucy. I appreciate the clarification. Okay, so that one also passed. Can we move to the next slide, please? So we just did this one. Next slide. Okay, so this slide has 3 things that are all about equitable fee revenue to maintain state and county vital record systems. Paula, you have a question or comment, or is your hand still up from before?
Sorry, I'll lower it.
Okay, thanks. I just didn't want to skip. Derek, I see your hand.
I do have a question on this M7.
Yep.
Is this understood to be like a flat fee, or would this be something that's like a prorated based on issuance history or county population? Because that's something that would change how I vote pretty drastically. And in reading the comments from the survey results, it was clear to me that sometimes we're interpreting things to mean different things. So I want to make sure I'm clear on this one.
Thank you, Derek. That's such an important clarification. So this is in the way that this was written, in the way that this came up as a suggested option, it didn't specify if it was a flat fee or if it was based on the number of records issued. As an option, the suggestion was counties will pay an annual fee to maintain the vital records and statistics system. So I'd like to hear a little bit of discussion. So Derek, your point is well taken, that you might feel differently if it was a flat fee versus if it was prorated based on the number of records. Other thoughts or comments about M7, counties to pay an annual fee to maintain the vital records and statistics system? What are your thoughts? That's Lucy, go ahead.
I personally, my opinion is that it should be based on how many certificates are issued, a percentage of each one. That way, you know, if you've got more traffic and more business, you pay more, you issue less, you pay less.
Okay. Thank you, Lucy. Other thoughts? Jennifer.
So my thought, and I'm using this as another example that, you know, when you buy a license for a software package or an application, you pay a base, you know, a certain amount, whether or not you, like say for Word, for example, you pay your 360, you know, one base amount. And you do that if you write one document or if you write 500. So my thought would be for, you know, an annual fee to maintain, there would be like a base fee that everybody pays, and then perhaps, and there's other applications where everyone pays a certain amount, and then it's kind of prorated based on usage. But there's like a flat fee that you start with, because you have to buy Word for, $34 a month, and then if you're using it more, you pay more, like the different applications that you get. So that's how I was looking at my thought on what I was looking at the maintenance idea.
Thank you, Jennifer. Ginger.
How would that annual fee or that base fee be determined? Are there thoughts on that?
Well, that would be part of the conversation, working with Chloe and determining, what amount are we trying to do that in combination with, another fee increase with the other options that we have with the funding. It's just, again, it's another option to share instead of sharing fees, for example, we would do maintaining the system, having a flat fee to maintain the system versus doing, a fee share. And a fee share would be based on, the number of records you issue, and then you pay the fee share. I think that in situations in other areas where we do a flat maintenance fee, is you also can budget for it more, because you won't be able to budget for how many records you could maybe budget based on the previous years of issuance, but at least with maintenance you have an idea how much they can budget for and put it in the budgets to account for it as a cost, where when you're doing fee sharing, you're guessing based on the previous years, but that depends on the way the budgets are done at the counties.
Right. So I'm hearing 3 different approaches to this. One of them is to have an annual flat fee, so we'll call that option A. Another one is to have a fee based on a percentage of the number of records issued. And then the third one is to have both a flat fee and then also a fee based on the number of records issued. Right? Those are the 3 options I've heard in response to this. Ginger.
Alana, when you're asking, and when you're on the third option, when you're saying flat fee, we're talking kind of terminology. That would be the monthly maintenance fee. Is that kind of what we're calling that, Ben? Just want to get the verbiage right.
Yeah, similar to like
Okay.
what you pay for a basic application, and then you pay the monthly fee, and then it would be, kind of
Okay.
prorated based on the,
Amount you
ranges of records
Gotcha. Okay,
issued
thank you.
or
Thank you.
usage.
Okay. So we're going to move to a vote now. So I'm going to say the options as A, B, and C again. So option A would be a flat fee. For example, a monthly flat fee. Option B would be a percentage based on the number of records issued. And option C would be a flat fee and an additional amount based on the percentage of the number of records issued. Right. So you can vote for Wally. I see your hand.
Yeah, I'm sorry to interrupt the flow of that vote, but I guess I'm curious. The flat fee option A would be, seems to me, are we calculating a flat fee that Josephine County would pay the same as Multnomah County, or based on historical perspective, how many death certificates? I mean, is there a calculation to the flat fee, or is Harney County paying the same as Lane County?
My thought on a flat fee is that everybody pays the same amount. That's a flat fee, so everybody's paying equal amount.
Okay, thank you.
Yeah. Thanks, Wally. Good question. Okay, so option A, I'll just run through them again. You can vote for one of these 3 options. Option A is a flat fee. Option B is a percentage of based on the number of records issued. And option C is a flat fee and an additional fee based on the number of records issued. I would say that sometimes when I've seen this, when there's been the second part, the additional percentage, that it makes the flat fee lower because of exactly what you were talking about, Wally, that counties that have a lot of activity through the percentage of records issued might end up picking up some of what the flat fee would cover. So, but it wouldn't necessarily have to be that way. It depends on how the system got set up. So, okay, so who wants to vote for option A, a flat fee? Can I see hands, either physical hands or hands on the, using the raise hand function? Who wants to vote for option B, the percentage of records issued? Okay, I see one. I see Wally. I see Derek. I see Joy. Okay. And then who wants to vote for option C, a flat fee and a percentage of? Okay, I see Virginia. I see Ginger. I see Sarah. I see Lucy. I see Jennifer. I think I missed somebody.
I was late voting for the second option, sorry.
Okay.
Me too.
I also would like option 2, please.
Okay, Janet and Paula.
And Virginia.
Also. And Virginia, thank you, Virginia. So I need to look to Cindy to do the tabulation. Where did we end up?
I would like to clarify that as well. Initially so 0 for option A. For B, I heard Derek, Wally, and Joy, and then we just added Paula, Janet, and Virginia. But I had Virginia down for C, so I'm not, could you confirm?
It was B.
Okay, so then for C, I have Ginger, Sarah, Jennifer, and Lucy.
All right. So that has option B winning, the fees by percentage, a percentage of records issued. Okay. So now we're going to look at M8. The state charges a $1 fee per order issued from overs to help support the operational and maintenance cost of overs.
I need to apologize. That should have been an X instead of a 1. I made a mistake on an edit there. I think it's just an X fee, like not a specific dollar amount. Sorry.
Okay, the state, thank you, Cindy. The state charges counties X dollars of fee per order issued from overs to help support the operational and maintenance cost of overs. Questions
So can I clarify? It's so, because I don't think M8 was that. I think M8 was $1. The original M8.
Okay, it may be then on the original. Maybe
Okay,
I might be mistaken.
Okay.
Thank you.
So
All
is
right.
this, yeah,
So it's
so
a
we just need
divorce.
to clarify, is this actually fee sharing or is it just $1?
I think that how it was written was $1 per order. That was the option as it was suggested by a work group member. So let's go ahead and vote on this based on the $1 fee per order issued from overs to help support the operation and maintenance cost of overs. So could I see hands in favor of the state charges counties $1 fee per order issued from overs in order to help support the operational and maintenance cost of overs? Can I see where hands are for that one?
I just a clarification for myself. So it's a
Yeah.
dollar per order, not for certificate issued, right?
This says $1 per order.
Okay.
Thank you, Virginia. Okay. Virginia, I see Virginia's hand. I see Wally's hand. Looking for any other hands.
I'm sorry. I was not intending to vote. I do have a question on this.
Okay, go ahead and ask your question and then I'll come to Paula and check in with you. Go ahead, Wally.
So family orders 6 death certificates from the county, comes back a week later and needs 3 more. Is that $2 or is that $1 per death?
It's $1 per order. That's how I read it. So every time that they get one issued, the $1 of that goes to the state.
Oh, I see. Okay. Thank you.
Thanks, Wally. Paula?
I was voting.
You were voting.
Yes.
Okay, so now that we've clarified that, let's try the vote again. So the state charges the county $1 fee per order issued from overs to help support the operational maintenance cost of overs. We're re-voting, so even if you voted before, please vote again. So can I see hands for this one? I have Paula. I have Virginia. Looks like that might be it. Did I miss anybody? Okay. So that one doesn't pass. The next one is create a percentage-based system for which the state sends the county monthly invoices for X percentage of the total certificates printed by the county that month. Questions or clarification about M9?
Yeah, so I think this M9, I mean, I don't remember M9 being one of the top ones that we voted on, but again, this is very similar to fee sharing. So creating a percentage-based system on which, so you're sending invoices for the percentage of the total certificates issued. Yeah, I think, yeah, I'm not understanding it. So is the idea that we get, that the invoice for the total certificates printed. So it's not clear if it's the full fee or is it a fee, a portion of the fee on this? I'm not too sure I understand how it would be calculated.
Yeah, and it does kind of overlap with the options from the A, B, and C options that we were talking about earlier. Yeah, if this is not clear enough to people how this would be, I would be welcome any thoughts about clarifying the person who wrote it, what you were thinking about when you wrote it. But there isn't a lot more information that we got. This was one of the options that was suggested. So create a percentage-based system for which the state sends the county monthly invoices for X percent of the total certificates printed by the county that month.
Do you mind going back to the previous screen?
The previous slide?
Yeah, if you don't mind. Just real quick. I'm sorry.
That was this one. This is, are you thinking, Paula, of the question about if we do a flat fee or percentage of records issued or a flat fee and percentage? Is that the conversation you were thinking about?
I need clarification on the question. Like,
yeah,
what's the difference?
Yeah, M9, we don't have more definition on it, and it may be that we can't vote on it because there isn't enough definition. It's not clear enough. I'm going to suggest that we skip this one because we did partially address it in M7 in that discussion, and let's look at the remaining questions for the group. So there were 3 different options that people were putting forward in terms of trying to maintain and improve staffing. So there were 3 statements in particular focused on staffing. One of them was to increase pay. One of them was to raise the salary for entry-level positions for people living in the Portland area in order to recruit and retain quality people. And one was to create and implement a uniform standard classification so the state has the same classifications as the counties that require a higher level of skill, experience, and training. These came up, they were options that were proposed. I'm not sure, because I'm not an expert on the legislature, of that these would be things that the legislature would be wanting to take a position on or make recommendations about, but they did come up as potential options. So I think we can go ahead and vote on them, and they can become part of the recommendations if the work group members want that. So the first one is to increase pay for the staff. Can I see how many of you would want to recommend that by raising your hand? Oh,
Yeah,
Jennifer?
no, yeah. I mean, I think all of us agree. This is what's really hard about this one. We all agree we need to increase pay, but when you're talking about specifically a legislation where we're talking about equitable access to birth and death certificates and equitable fees to make, and that's the intent of the bill. I mean, sure, we want to increase pay, we want to increase salaries, we want to create and implement a uniform classification. But what we're recommending to the legislature is to do legislation specifically related to equitable access to birth and death certificates and maintaining enough fee revenue to maintain and improve. And the bill does not say staffing. The bill says maintain and improve the state vital records system. So I think, I mean, if we want to recommend it, but this is going to be a hard vote because, of course, I support all of these, but I don't support them as far as a legislative request for a legislative report specifically related to the House bill. So, that's, I think there's some context here that's important to look at. And I don't remember that. I mean, I thought that in the list that we had before that these were these higher ones to be reviewing when we did the vote last time?
The reason that these are, thank you for that question. The reason that these are included this time is because they were on the bubble in terms of how many people voted for them. Wally, I see your hand.
I just want to say I couldn't agree more with Dr. Woodward on that. I mean, it's just really well said. I was not sure at all how I was going to vote on this. I just nicely done.
Thank you, Wally. Lucy?
I have to agree with both Jennifer and Wally. I don't believe that this slide and what's on it is in the spirit of what we're supposed to be doing. Equitable access and maintenance of what we've got and making it better.
Thank you, Lucy. Okay, so we're going to go through and vote on these. You can, they're here because they were identified as by the work group as recommendations. So we're going to go ahead and vote on them. If you don't want to move them forward, you don't have to vote for them. So first, can I see hands for MS1 increase pay? Okay. Can I see, I saw no hands. So can I see raise the salary for entry-level positions for people living in Portland area in order to recruit and retain quality people? Can I see hands for that? Okay, I see no hands. And then MS5, creating and implementing uniform standard classification. Can I see hands for that one? Okay, I see no hands for that one either. Next slide, please. So the last thing for us to do, you've all seen the draft report. It's a draft and it doesn't have today's voting and discussion in it, but it is a compilation of all of the things that we've done over the year, including, what was presented and what the discussions were and the recommendations from last time. So what we need from the work group is making the assumption that you have reviewed it, is to hear if you can approve the draft report. It's all, what's in there represents all of the work that you all have been doing this year, and the voting, most especially the voting from last month. So first, before we move to the vote on it, I want to see if there's any questions. Derek.
All of the voting has been like in this meeting and last meeting. I'm wondering if there are any people who participated throughout the year that weren't able to participate in either meeting, but were able to take the survey or anything else. I just would hate for their voices to not be included.
Thank you, Derek. It's a great question. Everybody who didn't respond to the survey, I reached out to personally. Some people have retired, some people are no longer in their role, some people have stepped away and not been able to engage in the work group. But the votes from today and last month represent all the people who have been participating consistently, and also have everyone, I've reached out to everyone who wasn't able to or available to participate more than once. So yeah, I appreciate that. In particular, I want to note that we have not had the level of participation from tribal representation that we were hoping for, and that person did give some input, and but has not been able to participate on an ongoing basis.
Thank you.
Okay. Yeah, thank you. That's a really important question. Okay, so let me see about hands for approving the draft report. Obviously draft because it didn't include today's conversation. It included everything up till now. Can I see people's hands for approving the draft report?
I have a question, Alana.
Yeah.
So what we did today actually changes a lot of what's in the, not a lot, but some of what's in the draft. So that's my question of, is there going to be an updated draft based
Absolutely.
upon what we're doing today?
Absolutely. Absolutely. Yeah, thank you, Lucy. That's a great question for clarification. Absolutely. Everything that we talked about today will be in the report. Yeah.
So do we not vote on this and wait for the draft, the updated changes? Or what?
Well, most things won't change. The things that would change are things that wouldn't be in the report yet because we hadn't voted on them yet. The things that are in there are the things that the group already voted on. And then what we will add is, so, let me say it this way. We're not voting on, we're voting on what happened in the past. And then what you voted on today will be added to the draft, so that the draft will be comprehensive and have all the parts. But what you're voting on is what you were able to see, which was everything that you voted on and discussed up until today. And then we'll add today's in to reflect the totality of the work that was done. Does that make sense?
Yes, thank you.
Yeah, thank you. Okay, so can I see hands for approval of the draft report?
Actually, Alana, can we clarify a little bit? Because I think we need to talk about the timeline, and, this is a draft. And so the question is also from the work group if they want to see another draft, because we do need to get this version to start the approval process by November 1st. So we have 2 weeks. So if the committee, if the work group wants to see another version of it, then we will need to do a voting via email.
Right. Yep. Thank you, Jennifer, which we absolutely can do. And if you would rather wait to vote until we add today's work into the draft, we can certainly do that. We just have to have it done before November 1st. What do people think? Ginger.
Well, personally, I would like to be voting on something that is the end draft. And I mean, I know that this was a second round of voting, but it kind of, for me, could present some loose ends, and I would rather it be more solidified before I give my vote.
Great. Thank you, Ginger.
Thank you.
Thank you. Okay. So it seems like that you might not be the only one who thinks that, because I saw some nodding when you were talking. So we'll do a revised version and get it back out to you and do an electronic vote. Sometime in the next week-ish, because we need to move this forward to so it goes through the levels in OHA. There's a whole process within OHA that it goes through after the work group has approved it. Okay, thank you for that clarification. Any other comments before we wrap for today? Oh, Ginger.
So supposing the second draft comes out and there are some questions regarding that, what is the step to do before the vote? Is this email going to include everyone so that it's, or how would that be handled, this clarification piece?
Yeah, I think it does make sense for the email to include everybody. And every time James sends out any of these communications, they go to everybody in the work group. There's nothing, right? Everything about this is a public process. It's all open for everybody to know about and see. So any comments or questions should also be public. Yeah, thank you for that clarification. Okay. All right, so we'll get something out. We'll do an electronic vote. There is opportunity for questions if people have questions, and we will respond to them as best we can. So this is going to be our last work group meeting. It's been a wonderful group, really thoughtful and engaged people. Deeply appreciate you all. I know it's been a lot of time for people and a lot of intense brain work. And you've all hung in there, and I really appreciate the work group members for your careful attention and your thoughtful attention to all of these issues. Any other questions or comments before we wrap for today? Janet said, thank you.
Yeah, thank you, everybody. It's been great.
Thank you. Thank you, Janet, for stepping in.
Thank you.
All right. Take care, everyone. It's been a pleasure working with you. See you electronically. Okay. Take care.
Bye, everybody.
Thanks,
Bye-bye.
Bye-bye.